Over 2 years, dozens of Rotarians and other community members from the La Crosse, Wisconsin area joined forces with 4 international Rotary clubs and did something extraordinary. They raised the funds necessary to buy a mobile medical clinic to serve the uninsured and the underinsured in their local La Crosse area community. 3 leaders of the effort cared so much about this project that they flew to Ohio and personally picked up the new vehicle so they could have the experience of driving it back home and showing it off along the way. The trip began on July 28, 2022. Hear them now share the story of how and why they were so committed to answering the call from the St. Clair Health Mission.
This was a dream of St. Clair Health Missions, and really during COVID, some Rotarians had the idea of, during this dark time, how great would it be to do a really compelling community project with a Rotary International grant to really kind of boost the spirits of Rotarians, boost the spirits of our community. So they invited, I think it was 7 nonprofits to come and pitch. You know, if you had one huge idea that you couldn't do now, what would that idea be?
Our past president of our Rotary After Hours Club, Josh Mancy, at the time was the District 6250 Foundation Chair. His wheels got turning and he said, you know, we do so many global grants abroad. There's such a need locally. Could we potentially do a local project? He then started to talk to some of his friends and mentors in Rotary, including my dad, Dean Dickinson, and bounced the idea off of my dad, and that was what ignited the project.
And understanding that the real work of St. Clair Health Mission over the next coming maybe 5 years was to really face outward. And that's where we thought of the mobile clinic to get to some of our rural areas where there's a high immigrant population.
Truly, it was an easy project to sell, but really just going and chatting with folks and telling them, you know, why I was passionate about the project and what this could do to help our community. I don't think anybody said no to me. I don't think anybody said no.
There were 3 of us. It was Marissa and Father Dean Dickinson, past district governor, and then myself. We landed in Ohio. It was a hot summer's day, but it was pretty exciting because that was going to be the first time we saw the mobile clinic. They did kind of a walk around and it was beautiful. Very blue. It's got the big logo and years worth of work, and so many in our community who had come together and kind of helped us raise the funds, helped us come up with the project, helped us make the project into a reality, and kind of being able to see it. And like that first time we could like put our hand on it and just touch in that tangible thing that so much, you know, hope and effort had gone into was so amazing.
Josh started driving because I was kind of nervous at first. It's 25 feet, so it's like driving an RV, and I had never driven anything that big.
When we got to start it up and pull it out of the garage and head on our way home, it was very exciting, and very much it felt like a Rotary adventure, years in the making.
I got the shift that went through the toll booths of Illinois and Indiana, and then I got the through Chicago part, and I was, you know, white knuckling it. We made it, no dings, scratches.
We stopped in Evanston, Illinois. We met with Rotary headquarters, staff, and so they thought it was just the coolest thing in the world that we had done this and we'd been able to do it, and we were able to bring it and show it to them. And they were very excited and very thrilled to see kind of the results of Rotary come to their doorstep.
And then when we got back to La Crosse, I had that stretch too. We wanted to hide it because we were doing a big reveal of it at Moon Tunes, Rotary Moon Tunes, the following Thursday. And so we were like, where can we park this where nobody's going to see it and ruin the surprise?
Our club, Valley View Club, sponsors a summer concert series in the park called Moon Tunes. So we drove the clinic down to the park and parked it in the grass right up by the band shell there, and the TV stations were there videotaping and interviewing us. And so it was a wonderful way to kind of say, wow, it's here now.
The first night that we had the mobile clinic out, we were doing sport physicals at a 85% minority high school, middle school. We hope to not get skunked our first night out, right? We've done this big plan. We have the unit, and now we're here. And it was pouring, torrential downfall. And so we were just hoping, gosh, I hope some folks show up. Within about a half hour, we had about 19 cars lined up in the parking lot to get sports physicals for their youth, and did that many physicals that night with 2 providers, handful of nurses, and some other volunteers. So it was an incredible start.
It's in many ways, it's kind of like a rolling billboard for Rotary. The primary intent of it is to be a mobile clinic to help the community, but we also wanted it to be something that people could look at and say, that's what Rotary is and that's what Rotary does.
The mobile clinic by far is my favorite thing that I've had the chance to work on, and I've had a lot of fun projects over the 25 years I've been a Rotarian. Just to have a little part to play in this amazing, huge project, I just feel very humbled and very good that I could contribute a little bit of my skill.
The mobile clinic represents service above self. It was an amazing project to work with some of my Rotary heroes in the community that I look up to and I consider mentors. And it was just such a humbling experience to see the gratitude, the love, the generosity of everybody that supported it.